Welcome to Understanding Alcoholism with Athena, Farah, Imaan, Mahitab, Michelle, and Ziniira. Alcohol, with the scientific name ethanol or ethyl alcohol, and street names like booze, juice, and liquor, is a clear, colorless liquid in its pure form. During the fermentation process, yeast changes the sugar in fruit, vegetables, and grains into alcohol, producing wine, beer, and cider with an alcohol content of 4 to 15%. Distillation reduces the water content, producing alcoholic spirits like rum, vodka, and whiskey, containing at least 40% alcohol. Historical and social considerations. Alcohol use and misuse are dependent on the definitions formed by cultural groups, so it is not always linked with negative consequences. For instance, in some indigenous groups, alcohol is used to reduce anxiety. 10,000 years of Western human development highlight beer and wine as the main drinks because water was considered dangerous for human consumption. With its low alcohol content, it was consumed by all ages throughout the day with few adverse effects. Alcohol's benefits included sanitizing the water it was mixed with, improving people's mood, relieving fatigue and boredom, helping to ease pain, being a major part of their daily caloric intake, and providing essential minerals and vitamins. For these reasons, excessive alcohol use and its negative consequences were not initially considered significant in comparison to its many benefits.
Some neurobiological effects are alcohol causing chemical imbalances in neural circuits, especially in the prefrontal cortex and the limbic system, disrupting memory, decision making, and sleep. It affects the basal ganglia, activating reward and incentive salient circuits. Drinking cues become motivational triggers, reinforcing habitual use. In the amygdala, alcohol use reduces reward signals and activates stress circuits, causing anxiety, irritability, and cravings. This involves a drop in reward neurotransmitters as well as anti stress neurotransmitters and a rise in stress neurotransmitters. The prefrontal cortex becomes impaired, weakening executive control and increasing impulsivity, stress, and negative emotions. This heightens the urge to self medicate. Alcohol use causes chemical imbalances in neural circuits, especially in the prefrontal cortex and the limbic system, disrupting memory, decision making, and sleep. There's also memory blackouts, seizures, headaches, and poor coordination, disrupted brain communication affecting the balance, speech, and judgment, and long term use shrinking neurons and impairing cognitive and motor skills. Alcohol affects the cognitive and motor domains involving executive functioning like selective attention, working memory and information processing, memory that's episodic, and visuospatial abilities, visuoconstruction, or visuoperceptual processing, as well as motor dexterity. Up to 50% of alcoholics do show deficits in executive functioning and motor control, but keep in mind that not all demonstrate measurable cognitive impairments. Some intoxication effects from alcohol use are slurred speech, slow, deliberate movement, decreased alertness, red, watery eyes, sweating, droopy eyelids, lack of eye focus, a flushed red face, drowsy or clumsiness, argumentative, and losing train of thought, and etc. Alcohol also impairs platelet aggregation, which prevents the platelets from plugging the site of the injury to stop the blood vessels from bleeding and impairing primary hemostasis, which will interrupt the process of the blood clotting.
Hello, this is Farah. Effects of chronic use of alcohol. One of the main global health risks is alcohol consumption. It results in over 200 diseases and conditions. According to the International Classification of Diseases, 25 of these diseases are entirely attributable to alcohol use. Some examples of alcohol-induced pancreatitis, alcoholic liver diseases, alcohol poisoning. There is an obvious dose-response correlation indicating that excessive consumption leads to health concerns. Chronic diseases associated with alcohol include cancers such as mouth, breast, colon, liver, and neuropsychiatric disorders like epilepsy and depression, and cardiovascular concerns such as hypertension and stroke, whereas low-volume alcohol consumption could have some protective impacts. Those advantages are capped but do not offset these extensive health hazards. In addition, for women, there is an stigma attachment to alcohol use disorder, which can interfere with medication compliance and might result in misdiagnosis. In general, alcohol continues to be considerable and avoidable contributor to the worldwide challenge of chronic diseases. Thank you.
Nearly half of individuals who drink heavily over a long period of time may experience alcohol withdrawal if they suddenly stop or reduce their alcohol intake. In severe cases, this condition can even become life threatening. Symptoms usually begin between 6 to 24 hours after the last drink. Some people may feel tremors, sweating, headaches, anxiety, or nausea as early as 6 to 8 hours. The peak risk period is between 48 to 72 hours when the most serious symptoms occur. While most people feel better by day 5 to 7, some symptoms can last up to 10 days. There are mild to moderate and severe symptoms. Mild to moderate symptoms include sweating, fast heartbeat, anxiety, while the more severe symptoms include seizures, delirium, severe confusion and hallucinations, paranoia. If left untreated, delirium could even be fatal. During the first 7 days of withdrawal, cognitive decline can occur with the frontal lobe being particularly affected. Repeated withdrawals can lead to the kindling effect where symptoms become more severe each time. This increases the risk of seizures and brain damage. So, even after the initial withdrawal phase is over, the recovery process isn't done. Many people experience what's called post acute withdrawal syndrome. This phase can last for weeks or even months after someone stopped drinking. Some of the most common symptoms include mood swings that seem to come out of nowhere, trouble falling or staying asleep, intense cravings for alcohol, and ongoing anxiety. These symptoms can be frustrating and unpredictable, and they are a big reason why relapse can happen even long after someone's physically detoxed.
Thank you, Ziniira. This is Mahi, and I'll be discussing overdose, poisoning, and associated risks. Alcohol is a central nervous system depressant, meaning it slows down body process. An overdose occurs when someone consumes more alcohol than their body can safely process. When this happens, the liver becomes overwhelmed, leading to a sharp rise in blood alcohol concentration, BAC. If BAC rises too high, the overdose can escalate into poisoning, the most dangerous form of alcohol use. In this state, it can slow down or shut down critical brain functions, resulting in respiratory depression, unconsciousness, coma, or even death. But overdose isn't the only concern. Heavy alcohol use also increases the risk of long term liver damage, cancer, brain shrinkage, depression, sexual assault, accident, violence, and risky decision making, particularly among young adults who may not fully understand their limits or the delayed effect of alcohol related to incomplete brain development. Thank you and pass it to Athena now.
According to Group ETAL 2025, alcohol use disorder is when alcohol use causes serious life problems. The DSM-5 divided by at least 2 out of 11 symptoms within a year. The severity depends on the numbers of symptoms. Mild is 2 to 3, moderate is 4 to 5, and severe is 6 plus. Signs include drinking more than planned, trouble cutting down, strong craving, and drinking despite problem at work, home, and with others. People may give up important activity, drink in risky situation, or keep drinking even when it harms their health. Needing more alcohol or feeling sick without it also the sign. Under the DSM-5, withdrawal symptoms can appear hours after stop drinking, and the sign may include shaking, sweating, high heart rate, trouble sleeping, anxiety, nausea, or vomiting. Severe cases may involve seizure or delirium tremens, which can cause confusion and hallucination.